Okay, so this is the CAPR. This is a supplement to our PAPRs, and you can use this in place of an N95. They have a hard shell on the top. This covers the entire air filter. The air filter is good for about a year, and the battery pack is good for anywhere from 8 to 10 hours. You're going to use this anytime that you have somebody on airborne precautions. So anytime you have to go into a room that you would normally need an N95 mask, you can also use this. The first thing we're recommending, and this is just our recommendation, is to put on a bouffant cap, because we have a limited number of these and everybody is going to be sharing them, so we want to keep our hair to ourselves. There are two items that you're going to add to this helmet. The first item is going to be your sweatband. So the sweatband has two sides, a soft side and a little bit rougher side. The rough side goes towards the Velcro in the front of the helmet, just like that. If you put it in backwards, it's fine. It'll just fall out and you'll just redo it. Once you have that in place, you're gonna turn this over, tuck it under your arm like this, because I found that's one of the easiest ways to do it. And you're gonna put on the face shield. When you first get the face shield out of the box, it does have a protective cover on it, so you're gonna peel that off. And then you're gonna put this face shield with the soft plastic facing the helmet. So that's gonna be towards your face. This toggle you want to have horizontal. You're gonna take the face shield, you're gonna pop it on that, and then turn that so that it keeps that face shield on for you. Once you have that in place, you're gonna pop it on either side, just like that. Those are the only two things that you have to add to the helmet for you to be able to wear it. Now, once you have the helmet ready to go, get your battery pack out, make sure that it's also ready for you to plug in. And you're gonna put your helmet on. With your non-dominant hand, you're gonna hold on to the strap. You're gonna make sure that it is turned all the way to the left, because as you turn it to the right, it gets smaller. So the bigger you have it, the easier it is to put on. With your dominant hand, you're gonna slide underneath the plastic on the face shield, and you're gonna put that plastic underneath your chin as you put the helmet on. Get the helmet comfortable on your head, and then go ahead and plug it in. And the reason you want to do that is because as soon as you put it on, you start rebreathing and it's going to start fogging up. Once the helmet is plugged in, it automatically turns on. If you unplug the helmet, it turns off. There is no on-off switch. This is it. So once it's plugged in, you're going to adjust the back strap by turning it clockwise until it's tight on your head, okay? Then you're gonna put a finger inside the mask on either side by your temples, and you're gonna pull this plastic piece down and back towards your neck as far as it will go. You'll notice that these two tabs on the sides will pop forward when you do that. That's the correct placement. That's where those are supposed to be. When this is on correctly, the air coming from the top, from the helmet, will seal this, and the only place you'll feel air escaping is by your temples. It'll go out by your temples. Nothing should come out by your neck. If you feel air coming out by your neck, you need to readjust. When you have the helmet on, there's an LED display here at the front that shows green lights. 3 green lights is full charge for your battery. 2 green lights is 75%, 1 is 50%, and if it gets to a red light, you have less than an hour's worth of charge. So if you get to that red light, you need to come out of the room, get this off, and get it back on a charger as soon as possible. This pack has a clip, so you can clip it to your scrubs, or you can put it inside your pocket, whatever works best for you. And then you're gonna put the rest of your PPE on. You're gonna put your gown on, you're gonna put your gloves on, and you're gonna go do your patient care. My face itches. When you get ready to come out of the room, you're gonna stop at the patient's door before you leave the room, you're going to take off your gown and your gloves, roll those up and throw those in the trash, and you're going to use hand sanitizer. This piece has to come out of the room for you to take it off. So after you've sanitized your hands, you're going to come out of the room. You're going to go where you can put this battery pack on a table, and you're going to put on a new pair of gloves because this is still considered contaminated. So once you have a new set of gloves on and you have your battery pack on the table, you're going to loosen this strap all the way. You have to push the black button to disconnect this. So you're going to push the button, pull this out, and then you're going to grab the helmet on either side and pull up and away from you, keeping the helmet out away from your body so that you don't recontaminate. You have gloves on, so you're then going to use a purple top canister for Sani wipes, and you're going to clean every surface of the helmet. The face shields are reusable, so you can clean this portion of the face shield and then pop it off. And you can keep the same face shield for the same nurse and the same patient. You need a different face shield for each new patient that you see. You're going to take your sweatband out. You're going to finish cleaning the inside and outside of this with your purple Cavi wipes all the way down your cord and your battery pack. And then once you've cleaned all of these, you're going to put them back in whatever container your facility is keeping them in. When you put it back in the container, you want to make sure that you plug that battery pack in, and also that you plug it into the wall. And that's it.